My name's Thomas Bailey. I'm a family physician from Indiana in the United States, and I have cervical spinal stenosis at C5-6 and C6-7. I don't know how it happened. I've always led an active lifestyle. I ski, I mountain climb. Growing up, I had a lot of physical activities and roughhousing with different people. So at some point I became injured, or it just happened. But for the last 2 years, I've had pain in my neck, in the back of my neck, and going across my shoulders. And progressively over time, it's resulted in numbness and tingling down my arms also. In the last month or so, I've also had some numbness and tingling that gets worse throughout the day in my mid-thighs going down to my feet, some burning in my feet. My quality of life initially was pretty good. I had a flare-up of back pain 2 years ago, right before a ski trip, and I was miserable. I had pain down the left arm, but I went ahead and skied and had a decent enough time and took some pain medication. And after about 12 weeks, the pain went away and stayed away for a few months. Since then, the pain would come and go, but each time it would come back, it would stay for longer, and there were shorter periods of time before the pain would return again. Recently, in the last 6 months or so, the pain has stayed. It's there when I get up, but it gets worse throughout the day. I do take some Lortab for the pain, usually one a day. But I'm a physician and I take call at the hospital, and I can't take narcotic pain medication. So on the days when I'm on call, I have to take Tylenol or Advil, and the pain's with me throughout the day. I've tried cervical traction, chiropractic, and courses of steroids without really any relief at all. I do have a 10-year-old child, Tommy, he's my son, and I really can't do soccer with him. It also limits any activities when I come home. By the time I come home, I want to take a pain medication and sit on the couch, which is not my usual lifestyle at all. Usually I exercise several times a week. My thoughts on the surgery is I'm very excited to do the surgery. I was offered fusion at 2 levels in the United States, but I understood that there would be some limitations in range of motion, that recovery would be significantly longer, and also there would be an increased risk that I would have surgery later at other levels. For that reason, I felt like ADR would be a better solution for me. I went on online forums, I went on Google, and I just would follow each link that I could find until I found the M6 disc, which looked really exciting to me. And on online forums, Dr. Clavel's name kept coming up. So I read more about him, sent the information, was told that there is a clear indication for the surgery, and since then I've had a video conference and also met with Dr. Clavel here in person. All of my questions were answered. I have a lot of confidence in him, and I can't wait for the surgery. I have 2 more days to wait, and I'm ready now. I wish it were today. Other than that, this will mean a lot more, obviously, when I'm done, and hopefully we can make another video where I feel great, but I do expect to feel great after this is done. So I'm Thomas Bailey. I'm a physician from Indiana, and I had surgery on Thursday, 5 days ago. And we did a video before that where I described my symptoms. So I woke up from the surgery and my leg symptoms were completely gone. The numbness, the tingling, the burning in my feet, and the pain in my low back were gone. And the tingling and numbness in my arms and hands were nearly gone, and they're still almost completely gone at this point and improving each day. The first couple of days after surgery, especially the day of surgery and the day after surgery, there was quite a bit of stiffness and pain in the neck, but that's at 5 days, it's basically gone. I can move my head around all I want and only feel a little bit of stiffness and post-surgical pain that's not too bad. Everyone here was very professional. The facilities are very clean and modern. The nurses are fantastic. They're very attentive to taking care of pain, taking care of making sure you're fed, and all of the things you might need. Most speak some English, some speak fantastic English, and also I was provided with an interpreter to stay at night in case there were any episodes that would need any attention. Dr. Clavel came and visited me Saturday and Sunday and made sure I was feeling fine and progressing. I went home Saturday. By Sunday, I walked 5 miles all over Barcelona. I walked another 5 miles yesterday, and I've already been out walking today. Barcelona is very hilly, and I've been able to go up and down the hills without any problem. I've seen, with my wife and son, 10-year-old son, we've seen cathedrals, we've seen art museums, the architecture, we've been riding the subways. It's just been fantastic. It's a beautiful city. The food's great. People are able to accommodate our English speaking. It hasn't been an issue at all. So we've just had a really good experience, and I would recommend it to anyone who is suffering similar pain. For me, I had a 2-level artificial disc replacement. I've already recommended the procedure to one of my patients who needs a 3-level replacement, and hopefully she can come and get the same level of relief that I've had. I had physical therapy in my hotel room yesterday, and it was very thorough, and it helped my range of motion and pain immediately. Some of the stiffness has gone away since then, and I look forward to another physical therapy session today before going back to Madrid tomorrow. So I just am glad you're here. I'm glad I was able to find you, and thank you for listening to my video.